calm day suddenly disrupted. Shift from normal to urgent. Most people think injuries give you time to react, but sometimes everything changes in just 1 second.
A simple step, a small mistake, and suddenly you're not in control anymore.
At first, you try to ignore it. You tell yourself, it's probably nothing serious. You attempt to move. You try to stand.
But something doesn't feel right. The pain doesn't fade. It intensifies. And slowly, a thought crosses your mind. What if this is more serious than I think?
In emergency situations, the biggest mistake isn't the injury. It's delaying the right action.
I thought I could handle it. It didn't seem that bad at first.
But the way you reacted, it didn't look normal at all.
The pain came out of nowhere. I didn't even get time to think.
And then you couldn't even stand properly.
That's when I realized something was wrong.
We didn't want to risk it, so we came here immediately.
I just hope it's not something serious.
Whatever it is, at least we're dealing with it now.
In situations like this, hesitation can make things worse. What matters is how quickly you respond and how clearly you communicate, because in emergencies, every detail counts.
Episode 22, D, Emergency Care, Orthopedic Injury. This episode is part of our playlists, Real Life Conversations and Medical English Conversations.
Notice how the conversation changes in an emergency setting. More direct, more focused, and more immediate. This is how real-life communication works when time matters.
At Fluent Ears, we follow a simple method. Listen carefully, repeat confidently, observe how sentences are used in real situations, and apply them in your daily life.
Because fluency is not just about knowing words, it's about using them correctly, especially when it matters the most.
If you find this episode helpful, you can support us through YouTube Super Thanks or via paypal.me/fluentears. Your support helps us create more practical and high-quality learning content for you.
Emergency room. Controlled urgency. Soft background activity. The glass doors slide open quickly. Emma enters, supported by Rianne. Her movement is uneven. She avoids putting weight on one leg. Her face shows clear discomfort. A nurse notices immediately and gestures toward an examination area. Dr. Miller approaches without delay.
What happened?
She slipped on the stairs. It happened very suddenly.
I missed a step, and my foot twisted badly.
When did this happen?
Around 20 minutes ago.
The pain started immediately.
Dr. Miller observes her posture, the way she's standing, slightly tilted, avoiding pressure on one side.
Are you able to stand properly?
Emma tries to adjust her position slightly. She winced.
Not really. It hurts when I try to put weight on it.
She couldn't walk properly. I had to support her.
Dr. Miller nods, calm but attentive.
All right, don't force it.
He gestures toward the examination bed.
Please sit here carefully.
Emma slowly moves toward the bed. Every step is cautious. Rianne stays close, ready to assist. She sits down gently, adjusting her position to avoid pain. A brief pause.
Where exactly do you feel the pain?
Emma points toward her ankle.
Mostly here, around the ankle, and slightly above it.
That's the area she's been holding since it happened.
It felt like a sudden twist, and then sharp pain.
Did you try to walk after the fall?
Yes, but it was very difficult.
She tried, but couldn't take more than a few steps.
Dr. Miller watches closely, the stiffness, the guarded movements, and her hesitation.
That's okay. You did the right thing by coming here early.
Emma exhales slowly.
I wasn't sure at first, but the pain didn't feel normal.
That's why we didn't want to wait.
Dr. Miller nods reassuringly.
We'll assess it step by step and understand what's going on.
Emma looks slightly relieved. Rianne gives a small nod. The urgency settles into focus. The evaluation has begun. The next step is to understand exactly how the injury occurred. Calm, but focused. The urgency settles into careful questioning. Dr. Miller pulls his chair slightly closer, maintaining eye contact.
Can you describe exactly how the fall happened?
Emma takes a moment, trying to recall clearly.
I was coming down the stairs, and I think I missed a step.
It happened very quickly.
Yes. My foot landed awkwardly, and it twisted inward.
Twisted inward?
Yes, like my ankle turned in suddenly.
That helps. It gives us a clearer idea of the type of strain. Did you lose your balance completely, or were you able to hold on to something?
I tried to grab the railing, but I couldn't hold it properly.
By the time she reacted, it was already too late.
Did you fall to the ground?
Not fully. I kind of stumbled and then sat down immediately.
She didn't collapse, but she couldn't stay standing.
Did you hear any sound at that moment?
Emma pauses, thinking carefully.
I'm not completely sure, but I felt something unusual.
She mentioned a slight crack feeling.
Yes, not a loud sound, but something didn't feel normal.
Dr. Miller nods, noting the detail.
Did the pain start immediately, or did it build up after a few minutes?
Immediately. It was sharp right from the beginning.
She couldn't move for a few seconds after that.
It felt like my leg just froze for a moment.
Were you able to take any steps after that?
I tried, but it was very painful.
She could barely take 1 or 2 steps.
I realized quickly that I shouldn't push it.
That was the right decision.
A brief pause. Emma looks slightly concerned.
At first, I thought it was just a small twist, something that would go away.
That's what we both assumed.
But the pain didn't reduce. It actually started getting worse.
That's important to notice.
He speaks in a calm, clear tone.
Sometimes injuries may look minor at first, but the body reacts differently once the strain sets in.
Emma listens carefully.
I didn't expect it to feel this serious.
That's why we decided not to wait.
Dr. Miller nods.
You did the right thing by coming in early. It helps us manage the situation better.
The details are now clearer. The way the injury happened, the immediate reaction, and the progression of pain. The focus now shifts to understanding how the pain is affecting movement. Focused, slightly tense. The doctor now observes movement and pain response more closely. Dr. Miller shifts his attention to how Emma is sitting. He watches the way she adjusts her leg carefully.
On a scale of 1 to 10, how would you rate your pain?
Around 8, maybe more when I try to move.
It increases even with small movements.
Does the pain stay in one place, or does it spread?
Mostly around the ankle, but sometimes it feels like it goes slightly upward.
She keeps pointing to the same area again and again.
Try to move your foot slightly, only if you can.
Emma nods slightly and attempts a small movement. She immediately stops.
I can move it, but it hurts a lot.
That's why she's been avoiding movement completely.
That's understandable.
He observes her closely.
Are you able to put any weight on it?
Emma shakes her head.
Not really. It feels unstable.
She's afraid it might get worse if she tries.
Emma adjusts her position again, clearly uncomfortable.
It's strange. I feel like I can't trust my leg.
She keeps thinking before every small movement.
Yes, even shifting slightly feels risky.
A brief pause. Emma looks down at her leg.
It feels like everything just stopped working suddenly.
Like your movement is blocked.
Emma nods.
Exactly, like my leg is completely dead in the water.
Dr. Miller looks at her, then explains calmly.
Dead in the water means something is unable to move or function properly.
Emma listens carefully.
In your case, your body is limiting movement to protect the injured area.
That makes sense. It really feels stuck.
And that's why she's not able to move normally.
Yes, your body is responding to the injury by restricting movement.
It's frustrating. I didn't expect it to affect me like this.
Even simple things are difficult for her right now.
I have to think before every movement, and that slows everything down.
It's not just the pain. It's the hesitation, too.
Dr. Miller nods, observing both the physical and emotional response.
That's completely normal in this situation.
The pattern is now clear: pain, restriction, and loss of confidence in movement. The next step is to understand her background and check for any additional risk factors. Slightly calmer. The focus shifts from immediate pain to background and possible risk factors. Dr. Miller sits back slightly, maintaining a steady tone.
Have you ever had a similar injury before?
No, nothing like this.
This is the first time she's dealing with something like this.
Any previous issues with your joints, bones, or muscles?
No, I've never had any serious problems.
She's generally been fine health-wise.
Are you currently taking any medication?
No, nothing at all.
Dr. Miller nods, noting the responses.
Before the fall, did you feel dizzy, weak, or lethargic?
Emma looks slightly confused.
Lethargic?
Dr. Miller explains calmly.
Lethargic means feeling unusually tired, low on energy, or slow.
No, I felt completely normal.
Yes, she wasn't lethargic at all. It happened very suddenly.
That's helpful to know. Were you distracted at the time, or in a hurry?
Emma thinks for a moment.
Maybe a little. I was trying to move quickly.
She was carrying something as well.
Yes, I think I wasn't paying full attention.
Dr. Miller nods slightly.
I've used those stairs so many times. I never thought something like this could happen.
Sometimes we get too comfortable.
Yes, I guess I stopped being careful.
A brief pause. Emma looks thoughtful.
Maybe this was the last straw.
Dr. Miller looks at her, then explains gently.
The last straw means the final small event that causes a bigger problem.
Emma nods slowly.
Yes, everything was fine, but this one moment changed everything.
Like one small mistake leading to a bigger issue.
That's a good way to understand it.
I didn't realize how quickly things can go wrong.
It only takes one moment.
Dr. Miller observes her calmly.
What's important now is that we understand the situation clearly and manage it properly.
Emma nods.
I just want to make sure I don't make it worse.
That's why we came here immediately.
That was the right decision.
The background is now clear. No prior issues, no underlying weakness, and a sudden mechanical injury. The focus now moves toward a detailed physical examination to confirm the extent of damage. Focused and clinical. The doctor prepares for a careful examination. Dr. Miller stands beside the examination bed. Emma adjusts her position slightly, preparing herself. Rianne watches closely, attentive to every movement.
I'm going to examine your ankle now. Let me know if anything increases the pain.
Emma.
Okay.
Dr. Miller gently places his hand near the injured area. He observes the swelling carefully.
I can see some swelling around the joint.
That's what we noticed as well.
It started increasing after the fall.
I'll press lightly. Tell me if it hurts more.
He applies gentle pressure along the ankle. Emma reacts immediately.
Yes, that spot hurts a lot.
That's exactly where she feels the most pain.
Dr. Miller continues, pressing different points methodically.
What about here?
That's uncomfortable, but not as sharp.
Dr. Miller, assessing the response.
Now, try to move your foot slightly upward.
Emma attempts the movement slowly. She stops midway.
I can't move it fully. It hurts too much.
She's been avoiding that movement completely.
That's all right. Don't force it.
He observes her range of motion carefully.
Now, try a small downward movement.
Emma tries again, cautiously.
That's a little easier, but still painful.
Understood.
He steps back slightly, then looks at her posture.
Try to relax your leg as much as possible.
Emma takes a slow breath, attempting to ease the tension.
I'm trying, but it still feels tight.
She hasn't been able to relax it since the fall.
Dr. Miller gently supports her foot and checks stability. Emma again.
There's clear tenderness and restricted movement.
What does that indicate?
It suggests that the soft tissues, like ligaments, may be affected.
Emma looks concerned.
Is it serious?
Should we be worried?
Dr. Miller maintains a calm tone.
We need to confirm the exact condition, possibly with an X-ray, to rule out any fracture.
Emma, slowly.
I understand.
It's better to be sure.
Exactly.
He steps back, having completed the initial examination. The signs are now clearer: swelling, pain on pressure, and limited movement. The next step is confirmation and diagnosis.
Calm and reassuring. The examination is complete. The focus shifts to clarity. Emma and Rianne sit quietly, waiting. There is a brief pause before Dr. Miller speaks.
Based on your symptoms and the examination, it appears to be a severe ankle sprain.
A sprain?
So it's not a fracture?
At this stage, there are no clear signs of a fracture, which is a positive sign.
Emma exhales slowly.
That's a relief.
We were really worried it could be something serious.
The pain felt intense, so I wasn't sure what to expect.
Dr. Miller nods calmly.
Pain can sometimes feel very strong, even in soft tissue injuries.
So the pain doesn't always mean something is broken?
Exactly. In simple terms, your ankle ligaments have been stretched beyond their normal range.
Emma listens carefully.
Ligaments. Those are the tissues that support the joint, right?
Yes, they connect bones and help stabilize movement.
So when they stretch too much, it causes pain and instability.
That's correct.
That explains why it feels unstable when I try to stand.
Yes, your body is reacting by limiting movement to protect the injured area.
A brief pause. Emma looks slightly calmer now.
I was worried I wouldn't be able to walk properly again.
That was our biggest concern.
There's no indication of permanent damage at this point.
That's reassuring.
Most sprains improve with proper care and rest.
So recovery is expected?
Yes, as long as you follow the right steps.
I'm glad we came early.
It helped us understand the situation clearly.
Early assessment always helps prevent complications.
I didn't realize a simple twist could lead to this.
It shows how sensitive joints can be.
That's true. Even small movements can cause strain if the joint is not supported properly.
Emma nods slowly.
At least now I know what's happening.
And that makes it easier to handle.
Exactly. Understanding the condition is the first step toward recovery.
The uncertainty has now turned into clarity. The fear has reduced, replaced by a better understanding of the injury. The next step is to focus on recovery and proper care. Reassuring and practical. The focus shifts toward recovery and next steps. Dr. Miller adjusts his tone slightly, calm but more instructive.
The most important thing right now is to avoid putting stress on your ankle.
So I should not walk on it?
Try to avoid putting weight on it, especially for the next few days.
We'll make sure she rests properly.
Rest is important, but complete inactivity is not necessary.
So I can still move a little?
Yes, gentle movement is fine, as long as it doesn't cause pain. You should also apply ice to reduce swelling.
How often should I do that?
Every few hours, for short durations.
That's manageable.
I'll also recommend a compression bandage to support the joint.
That will help with stability?
Yes, it helps reduce swelling and provides support.
A brief pause.
You need to be diligent with your care.
Emma looks at him attentively.
Diligent?
Dr. Miller explains clearly.
Diligent means being careful, consistent, and putting in regular effort.
Emma nods.
So I need to follow everything properly, without skipping.
Exactly.
We'll make sure she stays consistent.
If you follow these steps regularly, your recovery will progress smoothly.
And if I don't?
Dr. Miller responds calmly.
If care is ignored or inconsistent, recovery can slow down, and in some cases, it may feel like progress is dead in the water.
Emma looks slightly concerned.
Dead in the water.
Dr. Miller explains.
It means progress stops completely or doesn't move forward.
I understand. I don't want that to happen.
We'll be careful.
Good. Once the pain reduces, you can begin light exercises to strengthen the joint.
That will help prevent this in the future?
Yes, along with maintaining awareness while walking and moving.
I'll definitely be more careful from now on.
This was a strong reminder.
That's the right mindset.
Emma takes a slow breath, looking more confident.
I feel better knowing what to do.
And now we have a clear plan.
Dr. Miller nods. The path to recovery is now clear. Rest, care, consistency, and patience. The final step is reflection and understanding what this experience has taught them. Outside the emergency room. Calm. A sense of relief replaces urgency. Emma and Rian step out slowly. Emma is more careful now, supported lightly.
That was intense, but I feel much better now.
Yes. At least now everything is clear.
Earlier, I was just worried without understanding what was happening.
And now we know exactly what to do.
I really liked how the doctor explained everything.
Yes. His explanation was hands down the clearest part.
Emma looks at him.
Hands down?
Rian smiles slightly.
It means the best, without any doubt.
Emma nods.
That's true. It made everything easier to understand.
A brief pause. They walk a few steps forward.
I also understand my mistake now.
You mean not being careful?
Yes, I got too comfortable.
That happens with all of us.
I think I was following the same routine without thinking.
Like doing things automatically.
Exactly.
Rian thinks for a moment.
You could say that routine had a kind of hegemony over your actions.
Emma looks slightly confused.
Hegemony?
Rian explains simply.
It means strong control or dominance of something over you.
Emma nods slowly.
So my habits were controlling my actions, without me realizing it.
Yes, and this situation broke that pattern.
That's actually true.
A short silence follows.
I've learned a lot from this.
And now you'll be more aware.
Definitely. I'll take recovery seriously and be more careful in the future.
Step by step.
Yes, no rushing this time.
They continue walking slowly, but with more confidence than before. The experience has changed something, not just physically, but mentally. Awareness has replaced carelessness, and clarity has replaced fear. A sudden moment can change everything. Today you observed how an emergency situation is handled step by step. You saw how the doctor asked clear and focused questions, how the problem was assessed quickly, and how simple communication helped reduce confusion, fear, and uncertainty.
Episode 22. D. Emergency Care, Orthopedic Injury. This episode is part of our playlists, Real Life Conversations, and Medical English Conversations.
At Fluent Ears, our goal is simple: to help you speak English naturally in real-life situations. Remember, fluency is not about using difficult words. It is about using simple English with confidence and clarity.
If you feel your English is not improving, don't worry. Progress doesn't happen in one day. But if you practice a little every day, you will improve. Just stay consistent.
Listen carefully, repeat confidently, and use what you learn in your daily life.
And remember, Fluent Ears is always here to support you. You are not alone in this journey. Just take one step at a time, day by day.
If you found this episode helpful, you can support us through YouTube Super Thanks or via paypal.me/fluentears. Your support helps us create more practical and high-quality learning content for you.